Irondequoit resident, welcome to Irondequoit. We plowed the roads especially with you in mind. It's funny the things that keep you awake these days, and I never thought the weather would be the most primary thing for me, but it is. But our crews do a great job, and we're grateful for them. Today, this has become a tradition. Assemblyman Morelli, Majority Leader Morelli, for the past several years now, during what amounts to really the busiest time of year, or one of the busiest times of year in Albany, where the final budget is being put together. He's always wanted to, as that process is unfolding in Albany, come and not only report back to the people, but great thing about Joe is he's always willing to take feedback and listen to folks. And I know personally how passionate Joe is, because I had the privilege of working for him for several years. I traveled with him to Albany. I'm much familiar of the complexity of the not just legislative process, but particularly the budget process. And Joe, in this case, experience is a good thing. He's been there long enough. But one thing about Majority Leader Morelli, as he's become now really a central figure in these negotiations, and Joe was always an influential legislator, but now Joe is one of the people who very much helped shape the final spending plan for the state, and we should be grateful for that, because it allows good minds in the room to come up with our state spending plan. But Joe really has never forgotten where he came from. So I think Joe, the people he represents, the communities he represents, is always paramount in his mind. So even as he's having statewide discussions, he's always thinking of the implications of people in Irondequoit, Brighton, and Monroe County. So that's something we should be appreciative of. So I'm very grateful you came here. I know Joe has terrific staff, is always willing to listen to folks. And I will just say this also, in Irondequoit, we've been able to do some pretty good things, investments in our community, over the past several years, first with Supervisor Bello, and continuing since I came into office. And we wouldn't have been able to do much of that without Joe's support, whether it's legislative capital, whether it's helping just keeping Irondequoit in mind in negotiations and things that happen in Albany. So we're grateful for that. So he knows how grateful we are. But with that, I would like to introduce Irondequoit's own Majority Leader, Joe Morelli.
Good morning. Thanks for brave. Although the weather's not bad, but you still probably had to dig out a little bit. I know I was shoveling snow this morning. First to town of Irondequoit for allowing us to be here. They're great hosts. Whenever we have events, we look to try to do them here, because people are familiar, obviously, with the campus and the library. We do events over there, so I appreciate that. And I always appreciate my dear friend Dave Seeley. We truly have a partnership, and as the supervisor said, there are a number of projects in Irondequoit, whether it's the hope to build a community center at the former Medley Center, or whether it's soccer fields over near Camp Eastman, or the ball fields behind Town Hall, or the new DPW garage. All those things are projects that we work on together. And Dave has just been just an outstanding leader. I think one of the finest leaders Irondequoit's ever had. Could you give him a big round of applause for Dave Seeley? So I'll try to go through my presentation quickly, although there's a lot to sort of go through. The state budget, as you'll see, is north of $160 billion every year at its current level. And so there's a lot in there, and I want to just touch on the highlights. A couple things of note before I start. The books and the presentation, not paid for at taxpayer expense. We try to put that in red, because I don't want anybody to yell at me for spending tax dollars for this. We raise all the money to do these events from contributors, so I appreciate that, and appreciate their help and support. And the second thing is, this is high level. The books you have are our representation of what the governor has proposed, and I'll get into that in just a moment. But if you want any more detail, there's links. Obviously, you can't press on the link on a printed page, although my 2-year-old grandson tries to do that. He thinks everything is, you should be able to flip. But there are links that will help you get to what we call the yellow book, which is the Assembly's basically analysis of the governor's proposal. You could also go on the governor's website, and all of the budget bills necessary to enact his budget are there, as well as memorandums which will describe what those are. So Without further ado, let me see if I can get into this. Let me start. It's not in the book, but I thought it might be meaningful to you to just understand a little bit about the process we follow, and then some of the limitations that there are relative to what the legislature can do in discussions with the governor. So the governor is required by Constitution to submit to the legislature in the middle of January a budget which details all the spending that he proposes that the state undertake during the next fiscal year, which of course begins April 1st. We have the earliest start of a fiscal year of any state in the country, and we have the earliest and quickest adoption period for the legislature once the governor submits a budget. So the governor submits in the middle of January. We get not only a presentation by the governor and a book which outlines his priorities, we get the actual bills, and there are a number of bills that are required for us to pass to enact the entire budget. Around the beginning of March, this year it's March 5th, which will be on, well, tomorrow, so it'll actually probably be Monday. The legislature is required with the governor and with the state comptroller and both houses of the legislature to come up what we call a revenue forecast that is compiled that looks at what numbers, what taxes the governor has proposed, what revenue package the governor's proposed, and then we do an estimate of what we think that will generate in terms of money. The governor's already done his analysis, but since he's submitted his budget, he comes up with a revised estimate because it was 6 weeks ago, and we now have the benefit of additional filings by people who file quarterly returns, et cetera. So we'll get together and we come up with this revenue forecast, which will be agreed upon by Monday, which usually and typically will give a little bit more money than the governor proposed in his budget. Now, if it's in bad fiscal times, it could be less. It so happens this year, and I can tell you a little bit more about that later. It's up a bit over what the governor proposed. Not a huge amount, but it does give us a little more revenue than we anticipated. Then, the middle of March, typically, the Assembly and the Senate will each pass resolutions which will pretty much detail what we disagree with the governor about. So if there are things that he's proposed that we agree to, we simply say we agree with that, but there may be a number of things, and as you can imagine, there always are a number of things that the Senate and the Assembly disagree with on the governor. We'll pass separate resolutions that detail our differences. And then we begin a process of conference committees where myself, the Speaker, the Chairman of the Ways and Means Committee will meet with our counterparts in the Senate in open public session and begin to go through the differences that are between the Senate and the Assembly and the governor and try to begin to work out those differences. We also have a number of subcommittees. The committee chairs, the various substantive committees will get together in public session and begin to work through that as well. At the same time, we're privately negotiating, frankly, with the governor and the Senate leadership to try to come to a conclusion. Our goal, of course, is to have a spending plan in place by March 31st, which is the end of this fiscal year, and in time for the April 1st beginning of the next fiscal year. So that sort of process, God bless you. And what the other thing that I just want to mention is the powers of the legislature vis-a-vis the governor. Back in the early 20th century, as a result of constitutional provision changes, we entered into the era where we have an executive budget, where prior to that, different departments would just submit spending requests to the legislature, and the legislature would just take them up. And then the executive budget changed that, and the governor compiles all the requests from his or her department, puts them into his budget. He'll make decisions on whether or not he thinks the requests from the various departments are in line with what he wants to do, and then he submits to us. The legislature has limitations on what it can do with the governor's budget. And I won't go into get in the weeds. You'd really be confused. I'm happy to answer any questions about it. But suffice it to say, we negotiate, and the biggest leverage that the legislature has is the governor would like to agree with us on a spending plan by April 1st, because if we enter the new fiscal year without an enacted budget, the governor has only a handful of choices. One is to submit emergency bills to us that the legislature cannot alter. We can only vote yes or no. Or we have a shutdown of government, which obviously everyone tries to avoid. So the negotiation period, the governor has most of the leverage, but the legislature has the ability to, at least up until March 31st, really worked with the governor on any changes that we think are appropriate. And governors always want to agree with legislatures rather than force them to do things. If nothing else, it's because the public doesn't really like, sort of a one person deciding everything by him or herself. So the legislature is an important part of that. And in New York, where we have a pretty active legislature, we have, if not a full-time legislature, as close as it gets in this country, and we have staff. So we have significant ability to look at and analyze the budget and come up with proposals that would hopefully make it better. So, having said that about process, we're now in the midst of all this, and let me give you an idea. As I said, this process here is to really provide an overview for you of the highlights of the governor's policy, and then to take any questions or comments you might have. If you want a complete look at the yellow book, which will give you all kinds of charts and tables, that's the link in your presentation, which you can just go to online, and that's available. So, to give you just a general overview sense how we do this, we start by looking at the different component parts that make up the budget. And you'll hear different terms from time to time, particularly if you're in Albany, about different funding streams. I thought this, although this isn't in our yellow book, this is how I imagine it, because each of these funds is a subset of the one above it. So all funds at the top, $168 billion, is all of the money that the state takes in and disperses during the course of the proposed fiscal year, or the next fiscal year. So as you can see, it's really broken up into two separate segments. The first is state funds, which I'll go into a little more. 112 billion is what's proposed, and then the federal government will send us, it's generally federal funds, there may be other things, but primarily it's funds outside the state of New York. Federal funds, $55.7 billion, and when we get into a little further, you'll see that almost all of that is Medicaid, which is a federal program that the state must, by federal law, provide to its citizens, and then we share the cost with the federal government and a little bit with our local governments, county governments. So that gives you a sense of the overall scope. So within state funds, we break it down into two sort of separate and distinct categories. Operating funds, those are all the things we need to operate the systems of the state, and we'll go through that. And then capital funds, which are the dollars we segregate out to use for capital projects. So if we're building highways, bridges, if we're building hospitals, if we're building corrections facilities, they go into capital funds, kind of like you would do in your family budget. There's money for groceries and your utility bills, but if you're going to add an addition to the house, you'd sort of segregate that and probably borrow the money to do that, or you might get a mortgage or a home equity line. So capital funds, operating funds. Under operating funds, we split them into three general categories. Special revenue, which are sort of dedicated funds that we use by a function of law, things that we're required to put into a special fund that provides support for special activities. So certain transportation things are in special revenue funds. Debt service is really our mortgage payments. So like you may borrow money to buy a house, so your mortgage is your debt, or credit card is a debt. So you're not paying the full balance, and depending on how long a project's useful life is, if we're building a highway, oftentimes we'll borrow the money in the bond markets because taxpayers will use that for 20 years or 15 years, or if we're building a prison, perhaps 50 years. So the idea is to spread out those payments because it benefits taxpayers now and in the future, and the debt service is the amount of money we use to support that. And then general funds is really everything. It's like your checkbook. So if we're paying out of general fund would be the state payroll, our support to local governments for various projects. We have unrestricted aid that we send to local governments. That all comes out of the general fund. So think of that as sort of your ongoing operational funds. I just think it's useful because people will use different terms at different times. It's hard to know. If you were just the average person, you wouldn't necessarily understand what these terms mean. But all funds is really the top line. Now the governor has, and I'll talk about this in a second, has limited our ability under operating funds to grow year to year by no more than 2% a year. So that's really, the governor's has for his 7 years in office insisted that spending growth at the state level, the things that we control, the things that we have discretionary, have to be at 2% or less. Yes, sir. Why don't we do this? If it's for clarification, I'm happy to answer anything that clarifies. If it's a question of substance, we maybe at the end. Yeah. Correct.
Under that, where that goes, is that all for Medicaid?
Yeah, I'll get into the Medicaid budget. It's almost all for Medicaid. There is some money for Department of Education.
So I'm adding these numbers up, and I noticed that the bottom numbers add up to the state funds, and you haven't done anything in the federal funds yet.
Yeah, and that's what I really mean to show is just where the sources are. It's the state funds on the left, and federal funds I just put under one single basket, just to give you an idea of how much is the state is responsible for. So this is just another way of saying it, except it shows you year-to-year growth. As you can see, the general fund grows this year by 7.5%. Some of that is due to federal funds that have come in for the Affordable Care Act. We get money for that. We get some money for Superstorm Sandy still from the federal government. So that's gone up a fair amount. Operating funds, which is the one that I told you that the governor limits to 2%. You can see his growth year over year is 1.8 billion or 1.9%. It's short of the 2% that he commits to. And then there's the state funds and all funds underneath. I'm sorry, the general fund. I said state, all funds. General fund is the top level. That's the checkbook that I talked about that money comes into. The operating fund is 1.9%. All funds from the federal government is up 2.3%. That does include money for Superstorm Sandy and the Affordable Care Act. If the Affordable Care Act and Superstorm Sandy money wasn't in the state budget, which we have to receive and pay out, then the all funds number would be about $158 billion. They're about $10 billion. So this is where our money comes from. As you can see, the federal grant is the single largest piece. Again, that's almost all Medicaid, and I'll show you that in just a minute when we go through what we spend it on. Personal income tax in the state is just short of $50 billion. And as far as income tax goes, New York State is somewhere in the middle of the pack of the 50 states. Most people think that the state income tax is higher than most states, but actually it's not. You know, the challenge we always have is to fund property taxes, which is how we fund schools and local governments, and that puts us higher in the country than most states. But as far as income taxes, we're about the middle of the pack. We get some other receipts. Business taxes are about $8 billion. User taxes and fees, $17 billion. And then we have some other miscellaneous taxes and miscellaneous receipts, which we get in. But that's how it all adds up and where the sources are. This is what we spend it on. We spend about $20 billion to operate the state government. That's the state payroll, the state prisons, etc. We also have the STAR rebate program, which many of you probably benefit from. I think almost everybody who owns a home benefits from the STAR program. There's enhanced STAR, and then there's regular STAR. The state actually pays that to the local governments, to the school districts. It's $2.4 billion this year, and the governor's proposed a change in that, which I'll talk about a little bit later. Social service and health, $14.2 billion, and then Medicaid is $60.3 billion. Education, which is the single largest expenditure we make that's discretionary because Medicaid is a federally required program. Education funding is not. That's at $32.8 billion. That includes everything. That's not only aid to the local schools, but it also supports the state education department and other things that we spend money on in education. Higher education, which is CUNY and SUNY community colleges, is at, and the programs that support young people like tuition assistance program, Excelsior scholarships come under higher education at $3 billion. So the governor's proposal, we have to in New York have a balanced budget. It's a requirement under our Constitution and under our statutes. It's different than the federal government. The federal government can run deficits and typically does run a deficit. It's rare for the federal government to have a surplus. They can go out and print money, and they can go out and borrow money to make up the deficits. We're not allowed to do that, so it has to be budgeted. It has to be balanced. The governor proposed. What's that?
Not government, is we.
Yes, we.
Okay.
Well, who did I say they? The federal government? Yeah, well, I mean they as opposed to the state government, which I represent. So, yes, we. The government can borrow money at the federal level, our money.
Representing us.
Yes, no, but I'm talking about the difference between the state and the federal government. So, $4.4 billion was the budget gap when the governor sat down at nearing the beginning of the year when he had to submit his budget to us, he proposes to us that we close that gap in two ways. The first is by spending reductions of $2.7 billion. There's $1 billion in revenue actions. Those don't necessarily mean new taxes, but there are revenue actions, and I'll talk about some of that. And then resource changes is redirecting money that we already have in a way that will help close the budget gap. So by virtue of doing that and resetting the starting point, the governor's able to deal with some of the what we call out-year deficits, which are those projected deficits into the future, and as a result ends up with surpluses in the out years. And this is how that goes. Prior to changes that we'll make in this budget, if you looked forward, we would have a deficit this year of over $4 billion, next year over $6 billion, and by 2022 we would have an $8 billion deficit, which, by the way, compares to when Andrew Cuomo first became governor, the first year, his first budget, 2011, we faced a $10 billion gap just that one year, which we closed. So because of changes he proposes in his budget, now you look on the right side of the screen, the deficits are effectively gone. A slight deficit it shows for 2020, and then surpluses in the following years. So let's go through the just top line things. And again, these are pretty top line, so any additional information, go online or feel free to call my office, and we're happy to get you information on this. So we spend out of the proposed budget $2.3 billion appropriated by the governor to support economic development initiatives and those agencies charged with economic development. This is almost exclusively state money. And here's some of the highlights of it. He proposes $1.27 billion for capital project investments throughout the state. That's capital versus operating. But it is below last year's. It's a deficit. It's a decline over last year, but that's because we had a big infusion of spending last year. High-tech innovation, he proposed a new appropriation of $300 million. That's out of state operating funds to support research, development, and innovation technology projects. This is part of our ongoing effort to make New York one of the leaders in innovation and technology, whether it's nanotechnology or whether it's chip manufacturing up in Luther Forest, up north of the Capitol. These are all things, that's work that's done at RIT, work that's done at the University of Rochester. We have a new data center that's being installed at the U of R in conjunction with Harris Corporation, which is a state commitment to support some of the incredible work that Harris Corporation is doing, and all obviously targeted towards trying to grow jobs in New York in those sectors. And then there's the Economic Development Fund, $200 million in capital funding through the economic development to support things like Global New York, which is our effort to sell New York products around the world, Startup New York, which is a way to try to invest dollars in emerging and new companies, as well as open for business. Yes, sir.
Clarification on that. How has that been working out for return on investment, for how much we've been investing in capital companies and them providing workers?
Well, I think some of it is, if you're making an investment in a new company or new technology, and there's been a fair amount of criticism by legislators for return on investment, particularly Startup New York. So Startup New York was a program we started, I think, around 4 or 5 years ago. The idea is that we would charge for 10 years no taxes to companies that are started in one of our Startup New York zones. You have to be working with a university on new technology, and we would essentially try to nurture or incubate new companies with new technology. So that's been criticized by legislators. I personally am a supporter of it and have been a supporter of it. You're not going to get immediate returns on brand new companies. It's going to take several years for them to grow, to be able to expand their technology, to build prototypes, to get product to market. So it depends. The riskier you are or the lower you are in terms of the development of product, the more failures there's going to be. What you really hope is that you hit on a Microsoft, or you hit on, there's a company the first company we did in the state of New York in the private sector, private colleges, was a company called Datto, D-A-T-T-O. And a young man who had gone to RIT started a company in Connecticut but wanted to expand in New York. Came here. He has outstripped every single metric we've used. His job growth is such that he's moved from one building to another in downtown Rochester. He's hired something like 170 people, and his growth hopefully is unlimited. So you balance that against the number that tried and didn't succeed. So it's not as easy as it looks, and we're competing against every state in the nation and every country in the world to try to attract jobs and get investment here. So I could go through program by program. We have audits by each of them, and we'd be happy to get them for you. As I said, a big drop over last year. We had a significant investment in capital dollars, but we're still spending $2.5 billion in capital just in economic development projects year over year. The governor changed something back when he became governor, an idea that we like to think we created for him in my office, which is to have regional approaches to economic development. Every region in the state, and there are 10 that we've identified, have different strengths and weaknesses. So, for instance, in Rochester, we're focusing on photonics, we're focusing on food processing and agriculture because of big food suppliers and big agricultural interests. We're focusing on new generation manufacturing. That's a Rochester-specific approach that came out of the Finger Lakes Regional Economic Development Program. Each region has a separate one, and many times these are competitions. So regionally, we compete against other regions to try to secure more state dollars. We won a competition called the Upstate Revitalization Initiative several years ago, which was worth $500 million in capital investment, and we're continuing to put those into those key industries, and we believe we'll be successful, particularly in the area of photonics, which we're making big investments in. The Downtown Revitalization Initiative, every region gets $10 million to help identify one downtown area. So in our region, winners have been Geneva. Trying to remember what there was another, what was it? Batavia. So we're helping them and their local community build their downtown areas, and that seems to be pretty popular, one per region. I Love New York Tourism, the governor proposes $18 million in support for the Market New York program, which is an increase of $5 million over last year, and $3.8 million to local tourism matching grants, where a local tourism facility like Seabreeze might put some money into marketing, and it would be matched by the state of New York. So we're able to leverage local dollars. And then there's the Finger Lakes Photonics Attraction Fund. This is another project that the governor believes strongly in, which is our photonics region. It's only in this region, a $30 million fund where we'll be able to attract integrated photonics companies to set up their manufacturing operations. We don't only want to do research and development in photonics, we want to do manufacturing. And that brings in, obviously, a great deal more jobs and hopefully more investment by the private sector. Each of these initiatives, too, that the governor has proposed in economic development over the last 7 years require private dollars. So it's not the state of New York paying for the whole thing. And typically, we'll put in 1/5 of the dollars necessary. So the business usually will have to come up with $4 or $5 for every dollar of state investment. And that way we make sure that that not only the local community, but that company has skin in the game, as they say. So infrastructure and transportation, $2.3 billion by the governor to support infrastructure and transportation projects and initiatives. We do get federal money for transportation initiatives. There are Tiger grants and other things that come to us from the federal government to enhance what we're able to put into. $4.3 billion. This is the fourth year of a 5-year, nearly $30 billion Department of Transportation capital plan. And it's, as I said, it's over a period of years. Last year, it was higher because it's not even over the 5 years. There are a lot of projects that we're doing. You know, the road and bridge construction community would like even more money, but as we see, there are a lot of demands on state dollars, so we're trying to increase not only capacity where it's warranted, but also to refurbish those roads and bridges that are state bridges and roads. And then below it, you'll see we provide money, almost $700 million for local roads and bridges. So hopefully some of that ends up in the town of Arundecoit, and Mr. Seeley and his highway department can distribute some of that. We have a program called the Consolidated Highway Improvement Program, which is known as CHIPS. That is over $400 million. $100 million is a relatively new program for Pave New York, again, to help local communities pave roads and reconstruct roads where necessary. $100 million for bridge programs, and $40 million for something called the Marcus-Selly program. And again, this is, as I said, we dropped down a little from last year in terms of capital investment, but this is according to a 5-year plan that we have. Next year, we will come up with a new 5-year DOT plan. Couple of things that are important. The governor's proposed $4.5 billion almost in support for transit systems. The MTA, which is in the Metro New York region, RGRTA, which is the parent of Rochester Transit Services, and it is an increase over last year. This is because we're trying to be more innovative in transit services, how we get to people, how we get people to places. The routes are changing. We're working closely with Bill Carpenter, who heads the RTS, on allowing mass transit to be more user-friendly. And then this is another initiative which is not without some controversy, but the governor is hoping to implement a cashless tolling system along the thruway and any toll roads in New York. So if you have an Easy Pass, you've already experienced cashless tolling, but this would be for everyone. So it takes a while to get there because you need sensors on every toll road, because if you don't have Easy Pass, we're going to get your license plate number and send you a bill. So pay your tolls when you go through, either in person or cashless. But if we get to the system, ultimately everyone would have either an Easy Pass account or something like that, and you'd pay without stopping at the toll to take the ticket and to give it back. Yes, sir.
Question with that, the toll booth workers,
I'm sorry?
the toll booth workers?
Yes.
Is there something for them to work towards their pension or wherever they've been working as we close in on 2020?
Yeah, we typically, what we do, because there's natural attrition every year in the state workforce, so people meet retirement age, what we do is we will not hire any more, obviously, toll booth workers, and as they phase out, we will move them into other jobs and take care of it through attrition. Because there are going to be other people needed to work, and we still have a lot of people in the administration of the Thruway Department and the Department of Transportation. So typically, we would try to move them another place. So we don't see any layoffs as a result of this, but natural attrition and the movement of people will account for that. Thank you. So education, which is the big number. Yeah.
Oh, we wanted to create more jobs in New York State.
Well, we want to create more jobs,
And you-
but we're not going to create public jobs as much. We're trying to reduce the state workforce and make them private sector jobs. But in this case, because of technology, you're not going to have every toll booth isn't going to have people collecting tolls and handing out cards, because technology has really made that a way for us to save dollars over time and put it into other things. So we're creating jobs, but private sector jobs is primarily what we're trying to invest the money in. $35.7 billion is for the entire education apparatus, pre-K through 12. We used to say K through 12, it's now P through 12. This is to run the state education department, various educational programs, and for the support of local school districts. So, support for schools, the governor's proposed increasing support for schools by $769 million, and it comes into basically just a couple of baskets, which I'll get into in just a minute, but that's general support of public schools, GSPS. School aid on the right-hand side is increased by $716 million, and these are the different baskets. $338 million for what we call foundation aid, and foundation aid is essentially the money we send to school districts, unrestricted aid. They use it to support kindergarten programs, first grade programs, physical education, whatever is in the school. Yes, sir.
I don't understand the difference between the state paying for education and I have to pay a tax bill locally.
Correct.
What is the difference?
Yes. So that's a great question. So this is,
You could explain that, that'd be great.
yes. So this is the state portion of support for local schools, and then there's the property tax portion. So the property tax is generated by the local schools, and the bills are generated by the local school district. They're required under the new law, which was enacted back in 2011, I believe. They can increase their levy by no more than 2% annually, or the rate of inflation, whichever is lower. So in previous years, the last several years, it hasn't even been 2%. Last year was, I don't even think it was 1% last year. This year, for many school districts, it's 2% or a little more, because there's certain exemptions that they have from the cap. But largely, that's the thing. So the amount of money that you pay in property taxes, in addition to the amount that the state of New York submits to the local district.
Well, my problem is that my property taxes are going up like 50% on one property, 40 and 28% on the other property. That's why I'm here to talk to you.
Well, that's,
about that.
well,
I don't know if you're the right person to help them do that, but that is outrageous when it goes up like 26% on my
So,
in the assessed value.
yeah, so,
And that is what is gonna happen. I think it's gonna be very bad.
not to get too far off the subject, but you raise an interesting point, which is local governments are required periodically to assess properties to make sure that if there's one neighborhood that's really gone up in value and another neighborhood that's stable or has gone down in value, that they don't continue to pay taxes based on that. So we try to make sure that we reconcile the differences, and so periodically, towns are required to reassess properties. It does not translate into how much your taxes will go up, because if you look at the town of Arundecoit, virtually everyone in the town assessed value went up, but they're not going to raise more money, so what will happen is the rate per thousand will go down.
Well, the rate, they haven't told me what the rate is gonna be. I'm very concerned about this. And if the rate doesn't go down, I'm gonna have to move out of town.
Right,
It's gonna cost me an extra $1,000 a year for my property tax.
Right.
I haven't figured out the school tax rate yet.
right. So that is different and apart from this, and I think the town would be happy to talk to you about that.
Sir, if you want to talk afterwards, we can.
Yeah, you can supervise. Good, good. And there is a long process, just, this is sort of off the topic, but there is my assessed value went up in my house in Arundecoit as well. I think it's, in my case, entirely fair. I think the value of my house has gone up, and that's based on what I see as people buying property in my neighborhood and homes in my neighborhood. So, that'll go up. And that process is just really begun, and people will have an opportunity to talk to the assessor if they think their assessment is higher than it ought to be. And then there's a long process, formal process you can go through as well. So I would say you should either, if the supervisor's here, you might want to mention it to him on the way out, or call the assessor's office Monday through Friday. They're open from, I think, from 9 to 5? 8:30 to 4:30, and feel free to talk to them and get more information. So that's on the local property tax assessment. Yes.
Point of interest, you're saying that the increases in school tax was 1 to 2%. I'm on social security disability. They don't raise it to inflation rate. They have a different rate. So my increases don't match the increases that everyone else puts on me. And I have to adjust my budget, limited budget, to help everybody else's increased budget out. And then I'm not getting help.
Well, but school property taxes have not gone up. I don't even think Sherry Johnson's the School Board Association. Now I've outed you. What was the average increase in property taxes last year in Monroe County school districts? It was less than 1%.
The actual tax levy cap.
Percentage, yeah.
Yeah, it's like 1.6.
Yeah. So last year it didn't even go up 2%.
To the previous year.
Right.
But because of the tax levy formula, that.
And do you know the percentage of increase in social security disability?
No, but,
It wasn't that much.
well,
It wasn't 1.2%, so I'm having to pay a lot more. It's taking food out of my mouth.
well, and honestly, it would be almost impossible to make sure that every single taxpayer whose income went up or income went down, that we'd be able to do a customized per person increase. But this is how the formula works, and we're,
I'm not asking you to do that. I'm asking you to help out the people without a voice.
right,
You know, you've been mentioning about corporation and businesses, how many millions and billions. I haven't heard of giving that to people, individuals. I went to St. John Fisher and took business management, and 40 years of top-down flow of money hasn't worked. Have we maybe tried 1 year of bottom-up? Why don't we just give all the money to the poor people for 1 year and maybe see if that works? Just try it 1 year.
well, I think our schools would close, and that we obviously can't do that.
No. Well, excuse me, your
Well-
school's closed. How many billions do you have for these other people?
Yes,
I totally agree with what you're saying, but Social Security is the federal government.
right,
And school taxes are local government, and he's state government. They don't have any authority in either of those. So you need to be talking to Louise Slaughter and Charles Schumer and Kirsten Gillibrand about Social Security.
Right.
Those are your Social Security
right. We don't,
Or whoever, if you don't have Louise, whoever you have. And then your school board about your local.
Right.
That's, unfortunately,
Trust me,
Assemblyman Morelli isn't
Right.
involved in that.
Right.
I have spoke to all those state. I pay taxes. I may not pay the federal taxes, but I'm still paying at the grocery store, everywhere else taxes. And so it's still going up for me. He still
I-
has control of my life. I'm living here.
Well, I don't have control of your life, thankfully for you. Nor do I have control of almost anybody's life, including my own. But let me just get through this, and I'll take questions. So school aid goes up by 716 million. 338, as I said, that's the formula we give for unrestricted aid to various school districts. Everybody gets a different amount based on a whole host of factors. The governor set aside $50 million of that. It's not in addition to the 338. It's a part of that for community schools. This is our effort, particularly for urban poor districts, to get more social services into the school to help students and their families. 315 million goes for reimbursement, and these are increases only, not the amount we pay. We pay billions for this, but $314 million additionally for reimbursement, primarily for BOCES, transportation, and building projects. So if the East Arundecoit School District has X number of dollars that they spend in transporting kids by bus, we pay a percentage of that. It's called reimbursable because we reimburse them based on a percentage of the dollars that they spend. So it's expense-based aids. Same thing for capital projects and some other things they have. And then $64 million for a fiscal stabilization fund. Not really sure what the governor ever means by that. Usually we take that money and give it back to the schools and just unrestricted aid. Increase in state aid for schools. This is overall, not just the foundation aid, but it includes reimbursable aids, et cetera. You can see in 2009 and 10, at the height of what we were feeling from the fiscal crisis, we went down. We dropped it nearly $2 billion between 09 and 11. It's back up now. We've increased it over the last 7 or 8 years by about $6 billion. So this is a record amount to spend. And we do spend more per pupil than any state in the nation on P through 12 education. Now, school districts will still argue that it's not enough, and we would probably agree with that, but there's limits to what we can do within the framework of the money we have to spend. Full-day kindergarten conversion aid. This is to help school districts that don't have full-day kindergarten, and I think there are only 5 or 6 remaining in the state. One of them happens to be Pittsford. What's that, Sherry? Yes, I think there are like 3 in Monroe County. There's a couple down in Westchester and Rockland County, or in that area. So the governor proposes changing that and allow them to get conversion aid for 2 years instead of the current law, which is 1. And he proposes an increase in pre-K by, I believe, $15 million. It doesn't say it on that, but I think it goes up by $15 million. There's also expanding pre-K to now include 3-year-olds as well as 4-year-olds. Special education, the governor proposes providing $103 million for schools for the deaf and blind, $1 billion for preschool special education program, $330 million for summer school programs for school-aged children with different abilities. School food programs, the governor's trying to increase funding for those schools that have purchased 30% of their ingredients locally from New York State farmers. And there's also language to stop the bullying of students and children who have lunch programs through the state. It's called Prohibit Lunch Shaming, and requires districts to provide breakfast after school. They call it breakfast after the bell, I think. There's the Empire State After School Initiative. The governor proposes to add $10 million for after-school programs in high-poverty areas, so children at 3 o'clock don't go home. They stay in school, perhaps get tutoring, get other physical fitness activities, etc. And then there's early college, high schools. We're proposing to spend additional money to try to get either schools with low graduation rates to increase those graduation rates, or access to college, and many kids don't have access to college. This program is intended to help them do that. Under the area of higher education, we appropriate $16.5 billion. This is for the State University of New York, the City University of New York, which includes all the community colleges, and then there are higher education initiatives, things that we call opportunity programs, the Excelsior Scholarship, which now will include families with incomes of $110,000 or less will be eligible for the Excelsior Scholarship Program. Those are for students that maintain I think it's a 2.6 grade point average, and are in school for a minimum of 12 credit hours. So State University, $10.69 billion we spend each year, $115 million this year over last. Community college base aid, we pay the community colleges on a full-time enrollment basis, so we pay them $2,747 for each student that's full-time equivalent. So if you have one student that's doing 6 credit hours, another that's 9, we put those together, 15 credit hours, 1 FTE, and we pay the school for that. And then there's money for capital projects. SUNY, like everything else, buildings need repair. Sometimes we need new buildings. We need to do infrastructure at the campuses. So we propose nearly $1 billion in capital funding for operating needs and campus facilities maintenance. And that's SUNY funding. Yes, sir.
Are the projects spelled out in the budget or not?
There's a SUNY 5-year capital plan, and I'm not sure you'd find it actually in the governor's language, but we can certainly find, it's all public information as to what each campus will get. I was visiting yesterday with President Battles from Geneseo. They're doing a major infrastructure program. It's literally underground infrastructure. That's in the SUNY plan, and they will benefit from this. But those projects will be laid out, whether they're actually in the budget or whether we can get them through SUNY, but there's definitely a list of projects. Now, some of it isn't identified at the beginning of the fiscal year, because if a water main breaks or there's some maintenance problem that we hadn't anticipated, some of that money is just reserved for those kinds of projects. Yes, sir.
Are all these jobs local hires and prevailing rate?
Yeah, SUNY, that's a good question. There's been some controversy about SUNY over prevailing wage. Public works jobs are all prevailing wage in New York.
Local?
Well, that would depend. I don't know that we can guarantee local. We definitely guarantee prevailing wage. But if a contractor from, Ohio comes in and decides to bid on a job in Buffalo, we can't tell them not to bid, because then Ohio would bar New York companies from going to bid on Ohio projects. So I think we have some ability to give some preferences to New York-based companies, but reciprocity is really a big issue, particularly since New York has a lot of construction companies, and we do work in Pennsylvania, New Jersey, Connecticut, Ohio, et cetera. So we have to be a little careful about precluding it, because we'd probably end up on the short end of that stick. So tuition assistance program is the way that we provide support for young people who can't afford tuition, and that's based all on household income. You cannot get tuition assistance, I think, if your household income is over, I think it's $83,000 a year. Enhanced TAP is for students attending independent colleges and universities. So if you go to St. John Fisher, you'd be able and eligible for this. That's an increase of nearly $4 million over last year. Excelsior Scholarship, as I said, is the program that allows tuition-free for children in families whose household income last year was $100,000. It goes up to $110,000. And when the program is fully implemented, it'll be $125,000. Yes, sir.
With the scholarship, is there a requirement for these, for our future community members to stay in New York State? And what is your take on that?
The governor first proposed that, and honestly, I was a proponent of that. The legislature didn't agree with that. I thought if we're going to provide free education, that there ought to be a requirement that you stay and work in New York, or maybe convert that into the student loan instead. But the legislature simply thought that was too much of a constraint, so chose not to do it. The constraints, as I said, are household income, grade point average, and you have to have you have to be a full-time student. The DREAM Act is support for those children who've gone to high school in New York, were brought here by parents. They're not documented, they're not citizens, but they're here through no fault of their own. We don't allow them to access support to go to public education at the post-secondary level, and the governor proposes support for that. Healthcare and mental hygiene. So this is the $83 billion appropriated for health and mental hygiene agencies and programs. Let me just walk you through that. Part of this, the governor proposes $2 billion for potential losses to federal cuts in Medicaid. There's been a lot of talk about this at the federal level, the federal government scaling back its commitment to Medicaid, and they do that by reducing our reimbursement. That hasn't happened yet, but there's some concerns, so the governor wants to put some money away in the event that happens. One thing that has been changed, the second part of the left column, the $1 billion healthcare shortfall. I'm sorry, we did make that change. Good. Originally, the governor had proposed some additional money for the child health program called CHIPS, but the Congress decided a couple of years ago during the shutdown that they would extend it for 5 years. Therefore, we don't have to reserve money to pay for children's health and make up what the federal government's losses were. So this $1 billion healthcare shortfall is another fund that the governor has asked us to put together. He's taking that from money. Some insurance companies, there's one that's owned by the Catholic Diocese of New York called Fidelis. They provide health insurance for the Medicaid population. There's a proposal by a for-profit company to buy that, and the governor has suggested that when the diocese sells it, that the state of New York and its citizens would get the money from the proceeds of the sale instead of the diocese. The cardinal is not happy about this. I think we're going to end up reaching a deal with him to give some of the money to the state and let the Diocese of New York keep some of it. So, but that is intended to help safeguard against future losses because of federal
Is that all the money that's my question.
Yeah.
Is it the whole thing or is it?
Well, it's interesting. I used to chair the insurance committee. I would have, my eyebrows would have been raised then. They're certainly raised now. So the proposed sale, and this is just the metro area, so it doesn't affect us in terms of our insurance companies, but Fidelis serves the Medicaid population in Metro New York. They propose selling it to a for-profit company for $3.75 billion, and the governor's proposed taking $3 of that $3.75 billion for state purposes. Obviously, the diocese has said, we're prepared to work with you on a number, but not a number that is as big as that. The diocese proposes to put it into a foundation for programs for the indigent and poor in New York. So it's an interesting conversation. We have had in the past times where for-profit companies have converted, not-for-profit insurance companies have converted to for-profit. In those instances, we have taken some of that money because we think there's a public purpose. This is a different, slightly different circumstance, so we're trying to negotiate with the cardinal.
If they take a good chunk of it, why would they do it? You follow what I'm saying?
Well, they won't.
But
Which is-
they'll
now that's-
say, well, heck, we're not gonna do anything, you know.
Right, and that's what I've said to, that's what that's what those of us in the legislature have said, and I said it to the governor yesterday on a phone call, that if you can't negotiate a deal, they won't consummate the sale and we'll get nothing. So you're gonna have to be a little more flexible, which I think he kind of understands. He may not want to, but he does. So Medicaid, which is the big expenditure, $72.37 billion is our expenditures. That includes all the federal resources, as well as money that the state puts in. New York also requires that its counties, the component counties, pay a portion of the Medicaid bill as well. So, and it depends on the service. If it's long-term care, if you had a loved one that was in a nursing home, was on Medicaid, the state would pay effectively 40% of that bill. The feds would pay 50%, and then the county would pay 10%. Yes, sir.
Are the federal cuts to Medicaid in funding or funding and services?
I'm sorry, say that again, sir.
The federal cuts to Medicaid, is it just funding or is it funding and reduced services?
It's that's a great question. So the way the Medicaid program is set up, there are certain services that you must provide under the federal Medicaid program. And then there are a list of additional services that states may provide. They're called optional services, which the federal government will provide reimbursement for. What these cuts really are, there were a number of programs, particularly under the Affordable Care Act, which allowed us to expand Medicaid and capture more people that were on the bubble. And the question in Washington, it hasn't happened yet, but the question is whether or not they might eliminate that expansion so what it would mean is the services would be the same, the eligibility would change because the people who have been more recently added would no longer be eligible. So the state our attitude is that it's been a pretty cost-effective program, and that we would like to continue to cover those people, but it would mean the state would have no federal reimbursement. So the governor is proposing to put some of that money aside. Yes, sir.
I get Medicaid help from a TBI waiver. Familiar with that program?
Yes.
And the AIDS.
That's a traumatic brain injury, TBI. Yeah.
And the AIDS, some of my aides are upset that they are going to be phased out, like ILSP, the CIC are going to be phased out because there isn't a budget enough to compensate that.
Right.
I feel for these people, but I don't know what the answer is. Could you help affect that? And there is a program going into effect in 2 years when these people, I think they vote day every year, they come up for a vote and all that.
And I have a bill,
That-
yeah, I have a bill that would increase the funding for, under Medicaid for traumatic brain injury, because people on Medicaid get a certain rate increase, and I don't know, it was about 4 or 5 years ago, they uncoupled the Medicaid rate increases for people with traumatic brain injury. I think it was an oversight, I'm not sure exactly why it was done, so I'm trying to repair that and get additional dollars under the program for people with traumatic brain injury.
I don't have anybody here who's good this.
Right.
If they were here, they could tell you exactly what is going on. I just know about this because I'm peripherally involved.
Sure. And you can feel free to have them call our office and we'll provide additional. Was there another question in the back? Yes,
Kind of follow on.
yeah.
Instead of putting money away to support the future, has any thought been given to reducing the services?
Yes, there is thought to reducing the services, but what we typically will find, so let me try to find an example. So Medicaid provides, for people on Medicaid, so if you're in a nursing home and you're on Medicaid, we allow podiatry services to be covered in New York. And one of the reasons that we have chosen to do that is, first of all, the federal government allows it, so we do give reimbursement for it. But if we cut out the service altogether, what you find is people who have renal failure or have diabetes, they end up having far more traumatic results for those services, which we have to pay for under Medicaid. So it's a little bit like, you know, that old commercial, pay me now or pay me later. So we've opted to try more preventive and primary care so that we save dollars on the back end. It's just a decision that's been made by the state. But there could be a time in the future where the federal government no longer allows those optional services. If that happens, then we would be hard-pressed to pay for them without federal reimbursement. One of the other things I should mention is, for all the talk about New York being a high Medicaid state, New York's citizens pay $48 billion more to the federal government than we get back in services. We are the #1 donor state in the country, and our reimbursement under federal law for Medicaid is right around 50%, which is the lowest reimbursement that any state gets for its Medicaid program in the country. And that's because back in the 1960s, when they invented Medicaid, we were a much wealthier state vis-a-vis all the other states. But that's changed. But you might look at a state like Mississippi might get 80%. For every dollar they spend, they might get 80 cents back from the federal government. Every state has a higher reimbursement from the federal government than we do. So when people complain about New York being a rich Medicaid state, it's partly because we've expanded these services because we don't get as much reimbursement. If we had a very narrow program, we would still get less reimbursement, but now we'd be paying for in emergency rooms and other places for people with more advanced illnesses that we could have treated earlier on.
So that's
For
why
more.
it's hard to get a TBI waiver?
Well, the TBI waiver, that's partly the federal government's issue. We have waivers right now. Under the previous administration in Washington, we agreed with them on a 5-year Medicaid waiver, which allowed us to cover Medicaid services for things that haven't been covered before, with the hope of reducing, for instance, childhood asthma, fewer hospitalizations, fewer emergency room visits, diabetes, high pressure or high blood pressure. So the federal government agreed to give us additional money for that, but those waivers are all going away under the new administration. So, I'm sorry, I'm taking a lot of time, but these are good questions. Let me go on to the distribution of Medicaid. We are trying to manage care. What we did in Medicaid for a very long time was,
Managed care is what the TBI waiver is concerned about. Managed care, when it goes into effect 2 years or something like that, they say they are going to, the local services, the angels in their home, the CPR people are going to have to shut down because of managed care. I don't understand how that works.
yeah, so I'm going to try to describe managed care. So for many years, if you were Medicaid eligible and you were a Medicaid patient and you went to the doctor and the doctor said, well, you need chest x-rays, so you'd go there and they might give you different tests, and we would pay, it's called fee for service. So every time you went for service, the state of New York had a certain fee that we would pay to the provider for having delivered that service. So over time, we've realized that what would be more beneficial, both for taxpayers and we think would lead to better outcomes, is to look at a person on Medicaid, part of a population of Medicaid patients, and say to an insurer or to a provider, we will pay you X number of dollars. It's sort of considered a capitated rate. We will give you, based on the acuity of the people that you're covering, will give you so much money per person in Medicaid per month, and then you, the local healthcare provider, you, the local insurer that's administering the program, you provide for the best care for that person. If it costs you more, you have to eat it. If it costs you less, you get some of those savings. And the idea has been to control the costs of Medicaid. And we have now a Medicaid cap. This year, it's 3.7% more that we can spend in Medicaid than last year. That's something that the governor imposed on us. And what he does, he takes the increase in medical costs over the last 10 years and averages it out. So it's a rolling 10-year average, which takes out the volatility of massive increases in medical costs from year to year or a drop and smooths it out. But it limits us to a 3.7% increase. And one of the ways that we've tried to address this is by spending the money through these managed care programs, which now are not only for the Medicaid population, but you may be in a managed care system even in private insurance. So that doesn't cost the state money, but it's the move towards trying to manage care and trying to think about all the things that would keep people going to a primary care provider for routine checkups, for colonoscopies, those kinds of preventive medicines. So there's a lot of encouragement by the insurers to do that because colon cancer, for instance, is one of the most preventable cancers. If you have colonoscopies from the time you're 50 on, it is one of the most, right, my staff? I keep telling those over 50 to get their colonoscopies. So I do it because the statistics are overwhelming. If you catch it early, it's one of the most treatable diseases that there is. So those are the kinds of things under managed care. We also pay a quarter of the Medicaid dollars goes into long-term care. That's not under managed care. Some long-term care is under managed care, some is not. And all told, about 2/3 of all the Medicaid dollars in the state of New York, actually a little more than that, maybe 70%, is for long-term care, whether it's in the managed care program or whether it's in the traditional long-term care. So it's a significant amount of dollars. We make some payments to Medicare where we're coordinating benefits. It's a slight reimbursement back to the federal government for somebody who's Medicaid eligible that we paid that they paid for our bill and we have to reimburse them back. Disproportionate share hospital payments, that's for payments to hospitals for people that are just over the Medicaid amount the federal government allows for payments, and some of those go to hospitals, physician and outpatient care for people on Medicaid, and prescription drugs. Again, quickly, we put aside $400 million in support for healthcare providers like Rochester General Hospital's building a new wing. We'll try to get dollars for them for their capital costs. Yes, sir.
What is New York State's position on medical marijuana? Are you going to pass that law and make it legal? Because I think that a lot of people who have traumatic brain injuries could benefit by having that.
We actually have medical marijuana in New York.
We do.
Yes. So there's a dispensary. The local dispensary is at Eastman Business Park, right where the old Kodak Theater on the Ridge. It's only for certain diagnoses. My daughter, when she was, suffering from cancer, she got medical marijuana in pill form. There are a list of illnesses and diseases that you can get it for. We're expanding it. Traumatic brain injury is one of those things on the list for expansion. And those are obviously have to be prescriptions written by doctors, and the dispensary is open at Eastman Business Park. We're expanding that.
When did this happen? When did
We started medical marijuana, I think, 3 years ago.
3 years?
Yeah.
I'm just hearing about this from reading things on the web.
Yep.
That it hasn't been accepted in every state yet.
Yeah, that's correct. It is not. The federal government still considers marijuana a controlled substance. It is not allowed to cross state lines That's a violation of law. How we got the seeds to start growing the plants in New York, no one knows. Immaculate conception. So there you go. That's what we call it, immaculate conception.
You don't need seeds, you can clone them, and there's only, what, 17 illnesses?
Yeah, we're adding to the list though, and we're trying to expand this because there's more and more evidence that certain diseases can be helped. There's even some talk of opioid addiction being treated, believe it or not, by medical marijuana. So,
That's not what I learned, they taught me in school.
well, they taught you new things since you left school. They've learned new things all the time. Lead paint, we include requirements that municipalities report outcomes of lead paint inspections and remediation, particularly in high-risk areas. Everyone knows lead paint exposure is highly toxic, particularly in brain development and women's reproductive health. When we say Article 7 language, you'll see this in the book. Let me just quickly describe it. The governor's allowed under Article 7 of the state constitution, when he submits the budget to us, to propose changes in law in language. And I won't get into the weeds, but Article 7 typically refers to those language. Doesn't necessarily have an appropriation of dollars spent, but the governor's allowed for the purpose of affecting appropriations to give us Article 7 language, which the legislature can reject, change, or accept. Did you have a question? No. Heroin and opioid funding, the governor's proposed over $200 million for treatment programs. It also includes $50 million authority to support additional heroin and opioid programming, and the governor's proposed a 2 cents per morphine milligram equivalent for the sale of opioids. And one of the reasons for this is the governor's belief, and I think this has a fair amount of support in the legislature, that opioid manufacturers should pay a small surcharge given the opioid epidemic, and most of those dollars would go back into opioid treatment programs. There are just shy of 3 people in Monroe County dying per day in Monroe County just from the opioid epidemic. We propose adding money to support wage increases for direct care professionals for OPWDD, which is the Office of People with Developmental Disabilities, OMH, the Office of Mental Health, and OASIS, which is the Office of Alcohol and Substance Abuse Services. So you'll note that we increased the minimum wage. We want to make sure the direct care workers, those people working directly with clients and patients, get dollars for those agencies to help support their wage increase. And we're trying to expand programs under OPWDD. The number of children now being diagnosed either on the autism spectrum or other developmental disabilities continues to grow, and we're trying to keep up with that demand. Yes, there was a question, sir? Yes.
I don't see anything on Lyme disease prevention, which is something that's been increasing in New York State.
Yes.
Especially within our community, we have a lot of trees, as was evident in last March's storm.
Right,
I'm thinking more for my children,
right.
where there isn't too much. Is this where that would go?
Yeah, it would come under public health programs probably, or Department of Health, and we could certainly, there are dollars for Lyme disease, but obviously given the sort of the brevity of the presentation, I don't have it, but we could certainly get that for you. If you just ask someone on staff before you leave, we'll find out how much we spend. And I don't know how we spend that. I don't think it's directly to families, but it probably supports Lyme disease education, so physicians and doctors and other providers will know the symptoms. And obviously, we've been trying to reduce and at least contain the deer population. That's, around here, that seems like a losing battle. But we've done different things, including in the past, I funded some research at Cornell for sterilization of certain deer to reduce the population. So we can get more information for you on that. Yep. Human services, we spent $14 billion for human service programs and agencies. The governor proposes $35 million for supportive housing, solutions to end the homeless problem in New York, and support for AIDS housing. In addition, we allow OTDA, which is the Office of Temporary, I'm terrible with acronyms. Yes, thank you. Support for them to withhold payments to local service agencies that fail to comply with approved plans to homelessness outreach. Obviously, people who are homeless often have multiple challenges. There may be mental or behavioral health issues. We're trying to get that alcohol and substance use problems, so we're trying to identify that and have a more comprehensive way of dealing with it, other than just creating shelters where people are just transition in and back out, and doesn't really address the underlying problems. An additional $174 million for affordable housing, supportive housing, capital improvements to housing stock, subsidies for people in rental and rental assistance programs. Public assistance benefits, we will spend $500 million on safety net assistance. New York State is one of the only, if not the only, state constitution, not federal constitution, but requires us to have a safety net program for people who are indigent. So whereas there might be assistance under federal programs that end after so many weeks on support under New York's constitution, we have to continue to provide some support for those people and try to move them from crisis to more stability, and ultimately, we would like people to move to self-sufficiency. Childcare, nearly $1 billion for childcare, of which $800 million will be allocated for subsidies, and there's a lot of talk in Monroe County over the last several years about trying to, and the county supports some of this with some local dollars, but they have, for the most part, retrenched in recent years. This is to allow working poor to be able to continue to work and get a subsidy that helps at least reduce the costs of childcare while they work. So this is something that a lot of people are trying to get more and more dollars for. Temporary assistance for needy families, that's a federal program, TANF, but the state puts money in as well. And we have $1.33 billion for those initiatives. That's temporary assistance for needy families. It used to be called different things, but it's kind of what people generically refer to as welfare. It's called TANF in New York. And then an increase of $50 million, a decrease of $50 million for unemployment benefits. This is based on how many people are using the program. Unemployment is actually down, employment is up in New York, so it just requires fewer benefits. So we'll not need to spend as much for the unemployment insurance program. This is something the governor's proposed. This is obviously very much on all of our minds, is how to have a state sexual harassment program, both for state workforce and for private employers. It would require, for instance, an employer from acquiring as a condition of employment, an employee sign a written contract restricting his or her ability to seek justice related to unlawful discriminatory practices based on sexual harassment, requires certain things of the government. The Assembly has, in the last 5 or 6 years, completely undergone a transformation in our sexual harassment policy. It's now considered by sexual harassment professionals, people who deal with this issue, lawyers, et cetera, is one of the best that they've seen. We go through its extensive training for our employees and members of the legislature about what constitutes sexual harassment in the workplace. So we've really substantially beefed up what we want to do. There's some controversy about non-disclosure agreements and whether or not it protects victims or perpetrators. We're trying to work through all that, but that's very much on the agenda. Even though that doesn't seem like a budget issue, it's gotten folded into the budget conversation. Local government support, we provide $1 billion for local governments. This is not school aid. This is in addition to. This is for towns and villages and cities. We do that through something called AIM, Aid for Municipalities. That's $700 million. The governor continues to try to create more intergovernmental cooperation and shared services. I think a place like Monroe County actually does very well. Other communities don't do enough of this, so the governor is really pushing people to do that and to coming up with restructuring programs that would save presumably some dollars. I respectfully think that the governor overestimates how much money there is to save in some of these. He often says there's, I don't forget what the number is, 10,000 governments in New York, but he includes in that like a water district, which may not have any employees, or a sewer district or a lighting district, which there's no real money except that the people who live in that district pay for those lights or sewers or sidewalks, but there's not a government, so to speak. So I think those savings are sometimes overestimated.
Do you agree with this?
What's that?
Do you agree with the government restructuring the combined?
Well, I would like, if there were ways to restructure and combine services that are duplicative, yes, I would certainly agree, because it'll save money. I think he overestimates how much there is to be saved, because in places like Rochester, Arundecoit works with Brighton and other municipalities on mutual aid for fire. We work together on all kinds of back-end services.
Like plowing roads, so we didn't need to build a
No, we do, there are town roads that need to be plowed, and need to be salted, and the county can't do it alone. We share those services. Sometimes we'll plow a county road, or the county will plow a town road, and that's mutual. That's the way we share services, wherever it's the most efficient use of person power. City of Rochester gets $88 million from the AIM program. City of Buffalo gets $161 million. This is a fight that I take on every year, with limited successes to try to have more parity on this. I think the town of Arundecoit gets AIM. It's not very much, is it? It's, oh, so that's not bad. Thank you. You're welcome. Environment, energy, and agriculture, $2.3 billion, support environmental programs, energy programs. We continue. Our goal is by the year 2030 to have a 50% reduction in the state of fossil fuel expenditures and move from a carbon footprint to a more renewable portfolio. The Environmental Protection Fund is continued. Funding this year will be $300 million. Solid waste programs, park acquisition, open space programs, climate change programs are $20 million. And a clean water infrastructure fund, we're continuing to work on repairing and replacing old infrastructure, lead pipes, et cetera, that have caused clearly challenges in recent years, and they start to break down. Those old ceramic pipes and everything, they need to be replaced, so we're providing support for local governments to do that. You can see we've increased environmental spending over the last 8 years by 114%. It's level funding the last several years at $300 million. Superfund, we continue to support a $100 million appropriation. We're expanding support for energy storage, electric vehicles. We ultimately hope to be able to build big batteries that'll store energy. It's still somewhat elusive to store renewable energy for long periods of time and to transport it over long distances. $90 million in funding for state parks, and an additional $65 million over a number of years from the Environmental Protection Fund for the harmful algae blooms, particularly in the Finger Lakes. This has become a real problem, and we have 12 priority lakes in our region, many in our region, for the algae bloom, the chemicals to, and I don't know very much about how to get rid of algae blooms. I know we have money to be able to do that. Public safety and corrections is $7 billion roughly. That's the judiciary, that's the court system, those are the prisons, that's support for local jails, etc. There is a proposal which the governor has, which the Assembly will take up as a separate bill this week, that would remove firearms for people who are domestic abusers. Believe it or not, this is a controversial measure. I'm not really sure why, but if you're, domestic violence misdemeanors would be on the list of offenses that prohibit you to have firearm possession. The Child Victims Act, this is extending the statute of limitation for young people who have had sexually related violent offenses before they were the age of 18, and this is based on all the work that's been done related to the Catholic Diocese and others where there were known sexual predators, and children are now coming forward in their 30s and 40s to recount how they were abused. So this has become a very, very big issue around the country and around the state, and the governor proposes language that really is, began in the Assembly to try to address that. Bail and pretrial detention reform. There are a number of young people and old people who languish in county jails before they're even tried because they can't afford $250 or $500 in bail. The governor has proposed and has a fair amount of support in the legislature for bail reform, and in some cases we would, primarily for misdemeanors or nonviolent felonies, work with judges to try to make it so, assuming that there's no flight risk and assuming that there's no additional concern for public safety, try to make it more accommodating for people. I was at Rikers Island and visited it down in New York City a few months ago. There are 16, 17, 18-year-olds who have been in jail for a year awaiting a misdemeanor trial because their family can't come up with $500 for bail. So it's really become a situation that, and I think the Democratic Chronicle editorial board opined on this yesterday, saying that the legislature should do this. Indigent legal services, those people who are need public defense or civil defense services, and access to speedy trial. The old adage of justice delayed is justice denied. We're trying to make sure people get their day in court faster and the governor's proposed language to do that. New York's jail population, 66% of the population has not been tried. So a lot of people languish waiting for their day in court. 21% are sentenced. 5% are federal holds. Those are people convicted of federal crimes that are in our jails awaiting transfer. Some are parole violators, and 1%, just 1% of the local jail population is now convicted of a state crime and being readied for transfer to a state prison. Used to be much higher. That number used to be dramatically higher, and we've done a much better job of moving them to state prison so the local community doesn't have to support that. We do provide some financial support, but it's been, in the past, a burden on local jails. So, sorry it took a little longer for me to get through that, but there's a lot. I will say the actual budget bills are thousands of pages in length. It would be impossible to go through those lines, but we have all that available. So if people want more detail, feel free to get us. And do we want to use the microphone? If you don't mind, just in case people have a harder time hearing, we'll give you a microphone and ask your question. So Arlie and Elmer are going to do this.